Welcome back. To continue our discussion, talking about pelvic floor dysfunction, joining me for this segment is Carol Andrew. She's a physical therapist at OU Physicians in Tulsa at the Schusterman Clinic. Now let's jump in, because in our first two segments, Dr. Marinas did a very good job of telling us what pelvic floor dysfunction was and the signs and symptoms and how we acquire it. And it sounds like it's inevitable just due to women getting, I'd say, more mature versus aging, getting more mature in our life cycle. With you, we're going to focus on the things that we need to know and the exercises and what you can do as a physical therapist. Because he did mention that most women don't even know what the muscles are that can maybe assist with this particular phenomena. So let me start with you then, just by asking you, as a physical therapist, what is your first sort of entry into this? How are women presented to you? How do they get to you?
Well, women are referred to me in the state of Oklahoma. I receive patients on physician referral.
Okay.
Now, some states have direct referral, but in Oklahoma, they come from a physician. So I work with Dr. Marinas, you're a gynecologist. I also have primary care doctors, such as family medicine doctors, internal medicine doctors, other OBGYNs in the community that refer patients to me. So the patients are referred with a variety of diagnoses that Dr. Marinas has already covered. Incontinence problems where they can't control their bowel or their bladder, pelvic pain, where they're having pain with intercourse, pain with sitting, pain with function, but pain in the pelvis, and then the prolapse issues. So as he said, if it's a mild degree of prolapse, so that if the organ is beginning to shift out of position and even near the opening of the vagina, that can be treated by conservative measures. Now, not 100%, there's all individual cases, but the things that I work on is I work on function of the pelvic floor, which we'll talk about the anatomy of those muscles and why they're so hard for women to figure out how do you recruit them. But I look at the muscles throughout the entire pelvis also, because in most of my experience, and I've been doing this since 1995, it's not just the pelvic floor that's weak in women that present with these kinds of problems. There's external hip muscles, the abdominal muscles become weak, and so I'm looking at the entire, what I tell my patients, I want them to think about their pelvis as a box. So I look at all sides of that box, and so that's what I'm focusing on. So I'm going to be testing for strength, I'm looking at flexibility, and then proceed on with instructing them on things to do.
Now let me ask this question before we get into the muscles and what you sort of show us. When you talked about how the stomach muscles could be weak, for women, again, I'd ask that of Dr. Marinas in terms of exercising. Of course, the general exercising that we're doing is not helping that particular area and may be contributing to it. But let's say stomach crunches and things like that. When most of us think about that abdominal area, we're thinking about doing more crunches or something. Is that helping that area or not really?
Abdominal crunches, there is a place for that type of exercise, but research has shown us that when we do a crunch or a partial sit-up, whatever you want to call it, we're really recruiting muscle groups that are more external and not the deeper. There are 4 layers to the abdominal muscles. And so we want to recruit those deeper layers that actually are more the supportive aspect of what provides support to the pelvic organs, as well as what provides good corset type control in the trunk. So again, it's critical with patients who have difficulties with low back pain. Oftentimes they're working on crunches and their back still hurts, and it's because they're not really recruiting the right muscles. So it is not your typical what you think of as abdominal crunch type exercises. There's a whole array of things that we do, and we have to tailor it specific to that individual for where their level of function is.
Now you have some pictures here. Show us exactly what these are and how this can help us. Just turn it towards me here. We'll be able to pick it up.
This is the bottom of the box. So when we talk about the pelvis, we're talking about the bottom of the box, which is between the legs. And I usually want I always want my people to know where we're talking about the attachment of these muscles are. There are 3 layers of these muscles that are under our control in the pelvic floor. So this bone and this bone are your sit bones. This is your pubic bone in front, and this is your tailbone at the back. So right here is the urethra that empties your bladder. There's the vaginal opening, and here's the anus for your bowel movements. So the first 2 layers of these muscles lie towards the front part of the pelvis. And then if we take those layers off, we're left with all these muscles. That's
Okay.
the deepest layer of the pelvic floor. And again, here's these sit bones, there's the tailbone, and here's the pubic bone.
Okay.
So we've got the urethra and the vagina and the rectum.
Okay.
So the thing that I always want my people to appreciate is, if you look over here, and this picture's a little bit dark, so I apologize, but this is that pelvic floor. It attaches to a common tendon that is shared by hip muscles.
Okay.
So if the hips are not strong, the pelvic floor can't be strong. Likewise, if the hips are too tight, the pelvic floor might be too tight. And that is
Okay.
one of the reasons why people might have pain.
Now, let me ask
So-
this in our last few minutes here. Exercises. Are there certain kinds of exercises that we can do? For instance, some people may have heard of the Kegel exercises, where you squeeze as if you're
The
you're
difficulty
trying to do
is-
that. I mean, is that a part of it, or
The Kegel exercises are definitely what we're referring to. Dr. Arnold Kegel was the physician who identified that if women could help those muscles become stronger, they could help improve the condition of leakage.
okay?
So we are talking about that. The difficulty is too many times people are given a sheet on how to do these exercises. Nobody really checks them to see if they're doing them right.
Right.
And what they tend to do is squeeze their buttocks, which is not a pelvic floor muscle.
No.
Or they'll squeeze their knees together and they'll work the inner thighs, or they'll hold their breath, or they'll do a variety of things. Some women actually push as if they're having a bowel movement instead of actually tightening the muscles.
Right.
And so that's kind of where somebody who is trained and can help people, that's a large part of my job, is helping women identify where are these muscles, how do they identify them, looking for other muscles that are also part of the problem,
Okay.
and then working to help balance out everything within the pelvis.
So with these particular Kegel muscles, once we understand what they are and how to do them, and it's like trying to stop the urine stream. You're really
But
you're
we
really
shouldn't
squeezing.
do that as an exercise.
Right.
Okay.
Then how often should we do these kinds of things?
Okay.
Is it something that we would do on a daily basis, every hour? We can do it at work? Do we only have to do it at home? I mean, give us some guidelines
Okay.
here.
Fortunately, when you learn how to do these muscles, you should be able to do them very discreetly. You should be able
Okay.
to contract the muscles without everybody knowing around you that you're doing that. So you
Okay.
can do it sitting in a class. You could do it standing in line at the grocery store or at the post office. You could do it driving your car.
Okay.
We need to work both slow and quick function of those muscles. There's two
Okay.
types of muscle fibers in all of our skeletal muscles. And so the slow fibers are the postural fibers. They're the ones that we need to support the pelvic organs.
Okay.
The quick fibers are the quick reacting fibers that you want to come in when you cough, when you sneeze, to close off that urethra so you won't leak urine.
Okay.
So we train the muscles in both ways. So I train my people to hold for a specific amount of time, let go for a specific amount of time, and then to do quick ones on and off.
Okay.
So the recommended amount, and there's still much more research that needs to be done, but we say 60 to 100 repetitions a day of the entire sequence of exercises. So if
Okay.
people are doing 3 times a day, if they're doing 10 of the slow hold and 15 of the quick, well, that's 25 repetitions right there. And if you do that 3 times a day, you've got 75 reps, which falls within that 60 to 100.
Okay.
And so that is a pretty good condition. It is something we have to do for life.
Right.
As women, because
Right.
we will continue to lose postural control as we age if we don't work at maintaining it.
Okay, and starting it early too, so we
Starting
can
it
teach
early.
our
We need to
young
teach our
ladies
young people,
very early
yes.
how to do these Kegel exercises
Exactly
properly.
right.
Well, Jake is telling me I'm out of time. I know that was fast and furious,
That's
but
okay.
people at least understand that there is support, there's help, and a physical therapist such as you would be an excellent resource to help us learn how to do these muscle exercises properly so that we can maintain as much function as possible. Thank you so much for joining me,
you.
Carol.
All right.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments or suggestions for future shows. Please write me at Health Alert USA at P.O. Box 50913, Tulsa, Oklahoma 74150. That's Health Alert. And if you're on the email trail, please email me at healthalertusa@gmail.com. Thanks so much for watching, and I'll see you next time. And remember, getting in touch with your physical therapist, contacting Carol, and finding out, getting an evaluation of how to do these Kegel exercises properly. So once again, they can help save your pelvic floor and make you more functional. Take care. This program would not be possible without the support of OU Physicians in Tulsa.